What I want to make clear is the whole purpose of this bill is, under the cover of the pandemic, to drive the final nail into the coffin of the NHS. This is the culmination of 3 decades worth of legislation. What the bill will do is transform the NHS into the equivalent of a Medicare system, Medicare Advantage, where the public pay through the nose for a service controlled and delivered by the private sector. The legislation will remove the duty for your health service to provide you with a hospital. The NHS will, the integrated care systems will no longer be responsible to provide you the best care. They will have a legal duty to turn a profit. Private insurance companies will be put in charge of returning a profit. And how do they do this? Number 1, denial of care. Number 2, employ the cheapest and fewest possible staff. Now, you don't have to be a genius to work out what the consequence of that will be for patient care. We are already seeing 10 years worth of defunding and a crisis in the NHS, which a report recently published by the Royal College of Emergency Medicine estimated 4,500 people have died as a consequence of overcrowding in A&E departments.
How many died from blood clots?
If you add on top of that the 100,000 preventable deaths through the pandemic, it soon starts to add up.
How many adverse
What does this mean for my patients? GP services will be undermined. GPs are already being scapegoated for the failures of the NHS. Your doctor, your consultant, will not have the decision over your care. That will be handed over to the private sector.
Shame on the government, the dirty government.
What we must do is not only fight for amendments. We don't need amendments. We need this bill to be scrapped, and we need the NHS to be renationalised. Nothing else will do. What we have on our side, the advantage we have now, is that the public are starting to realise we have one of the most blatantly corrupt governments in living memory. They are listening to us, they can see the things happening around, their services being undermined. We have another problem in our democracy, is the lack of mainstream coverage. Where are the BBC here tonight? Where are Sky? Where are Channel 4? It's up to us. It's up to people like you. It's up to campaign groups like are gathered here today to raise awareness, to spread the word. It's a very easy message. We don't want American healthcare in England. We don't want insurers controlling budgets. This is the beginning of yet another fight, and it's down to us. Thank you for coming.
Thank you very much, Bob. And if you haven't watched Bob's videos yet, do check them out on Unite's Facebook and yournhsneedsyou.com. So our last speaker before we hand over to the choir is someone you may well know, Jeremy Corbyn.
Thank you, Marshall. Thank you all for being here tonight. And it's a real pleasure to follow Dr. Bob Gill, a fantastic NHS campaigner, for an NHS run for people, not for profit. That is the essential part of it. And for those people that are busy shouting over here, I'd simply say this: whatever views you may have or may not have on vaccines, you need the NHS just like everybody else. You need the NHS to protect you against illness. You need the brilliance of doctors like Dr. Bob Gill to help you. So I would urge you to join in a united movement to defend the principle of healthcare free at the point of need in our society. And I would also say that alongside campaigning for a free NHS and defending the principles of the NHS, we need also a national care service. Again, free at the point of need, just like the NHS. So many people go through such trauma in trying to find some way of supporting particularly older relatives who are in need of social care. And again, I say to you guys, whatever your views on the vaccine, support the NHS if you've got any sense whatsoever. The bill that's going to be voted on tonight is a conveyor belt for the selling off our NHS to those that will make money out of it. I warned in a debate with Boris Johnson in December 2019 that his proposals would bring in US healthcare companies to run our NHS. He denied it. In my own constituency now, we have one American healthcare company running a GP practice. They run 45 around the country, and they're increasing the number. So join the campaign against the selling off of GP practices. Join, and I say to you guys once again, could you shut up and listen to the principles of the NHS? And so when we vote tonight, those of us that support Richard Bergen's amendment will be the real people standing up for the NHS. We will be the people defending that principle and defending the health workers that have done such an incredible job to get people through the stress and the strain of the COVID crisis over the past 2 years. And so, what I urge you all to do is obviously watch what happens tonight. It's not the end of the story. Keep up that campaign. Keep up the demand for the NHS. It is the most civilised thing in our society. It was won by brave, far-sighted people. It is ours to hold and cherish and defend for the next generation. If we lose the NHS to those that wish to make obscene levels of profit out of the illness and misery of others, ration health care and bring in a charging system, we will have failed not just this generation but future generations. So well done those that defend the NHS, well done Unite the Union and the other unions for their campaign on this. And when NHS workers quite rightly demand a 15% pay rise, get behind them and support them. And in that sense of unity, of a just and fair society, we will deal with the health inequalities. We will deal with the level of lack of care of some parts of the country because of health inequalities. It is up to us to unite together to do that. Thank you for being here. Thank you for the campaign. Defend our NHS.